Good afternoon, everyone. Thank you for joining us today for the Hospice Quality Reporting Program, or HQRP, Achieving a Full Annual Payment, or APU, Update webinar. My name is Sharon Purcell, and I will be your host and moderator today. I have a few housekeeping items to share with you. This webinar is being recorded. We will provide you with details on accessing the recording via email when it is available. Closed captioning is available and will appear at the bottom of your screen. If you would like to download today's presentation slide deck, you can select the download this presentation option in the web links panel in the lower portion of the screen, and then click the Browse To button to connect directly to the presentation. If you download the presentation during the webinar, you will open a new browser window and may need to return to the presentation by navigating back to the browser window hosting the presentation, or by clicking the Adobe icon located in the taskbar. Due to a large number of attendees on today's webinar, we are unable to field questions over the phone, but you can submit questions electronically. The phone lines will be on mute for the duration of the presentation. The audience is in listen-only mode and will only be able to communicate with us by using the QA panel. If you need technical assistance during this webinar, please let us know by entering your question or concern in the Q&A panel to the right of the presentation. Answers to commonly asked questions have already been posted to the Q&A panel. You can view questions and responses by using the scroll bar within the QA panel. You may also ask any content-related questions you may have during this presentation via the Q&A panel. Questions will be assigned to presenters to address at the end of today's presentation. We will answer as many questions as possible during the presentation. Responses to all questions will be posted to the HQRP Requirements and Best Practices webpage with the next available HQRP quarterly update. The URL is available in the Q&A panel. For more Adobe Connect help, it can be found by clicking on the Help icon in the upper right-hand corner of the screen. During today's HQRP Achieving a Full APU, a Bare Bones Overview webinar, we will cover the following topics. Closed captioning is also available during this webinar. You will find the captions located in the panel directly beneath today's hospice presentation. The slide deck contains a reference list of acronyms that will be used throughout today's presentation on slides 5 through 7. During today's HQRP Achieving a Full APU, a Bare Bones Overview webinar, we will cover the following topics: an overview of the Hospice Quality Reporting Program, or HQRP, the HQRP life cycle and compliance, including the calendar year process, which includes reporting hospice item set, or HIS, and consumer assessment of healthcare providers and systems, or CAP data, using reports to track your hospice's data, certification and survey provider enhanced reports, or CASPER, knowing the Reconsideration Process. At the conclusion of today's presentation, you should be able to recall basic information about the HQRP, describe the time frame and the necessary steps towards HQRP compliance, describe the relationship between quality reporting and the APU, List the steps for using your HIS and CAPS data. Name at least 2 certification and survey provider enhanced reports or CASPER to check HIS and CAPS compliance. Recognize how to use reports to check HIS and CAPS compliance. Define the HQRP reconsideration process, including the time frames for the steps and steps for submitting a request. Locate resources on the HQRP website. There are a couple of icebreakers in today's presentation. During the presentation, we will occasionally engage the audience in polls. The presenter will read the question and possible answers. And the poll will appear in a panel to the lower right of the presentation. If you want to see all answers to the polling questions in the poll, you may have to scroll down. To participate in the poll, you simply have to select your desired responses to the question. Now let's try a couple of polls. How many people, including you, are joining this webinar together in the same room? A, just me, I am the only one participating. B, 2 people. C, 3 or 4 people. D, 5 or more people. Please select your responses now as the answers coming in. It looks like we have about 82 to 83% of people selecting A. Just me, I am the only one participating. Let's try another. Where in the United States is the very first hospice that opened in 1974? A, Boston, Massachusetts. B, Bradford, Connecticut. C, San Francisco, California. D, Washington, D.C. Please choose your answer. Okay. Looks like we have a lot of people selecting B. Let's see what the correct answer is. The answer is B, Bradford, Connecticut. Now, I'd like to introduce today's speakers. Presenting the HQRP, Achieving a Full APU, a Bare Bones Overview, are Brenda Clarkos, Cindy Masuda, and Deborah Dean Whitaker. Cindy joined Centers for Medicare and Medicaid Services, CMS, in 1999 as an IT lead and responsible for Inpatient Prospective Payment Systems, IPPS, payment policy in the Centers for Medicare Management, Division of Acute Care. Cindy has worked on Medicare demonstrations with a focus on hospice. She was the project officer in CMS's Office of Research, Development, and Information, now Centers for Medicare and Medicaid Innovation, CMMI. Royal Hospice Demonstration from 2005 to 2010. Cindy Masuda brought her subject matter expert on hospice as lead project officer for the design of the Medicare Care Choices model. She joined the Centers for Clinical Standards and Quality in 2015, where she is the Hospice Quality Reporting Program Coordinator. Brenda Clarkos is an Associate Nurse Researcher at APPS Associates. She is an RN with many years of clinical and administrative experience in community health, hospice, and oncology. She serves on the board of directors for the Hospice and Palliative Nurses Association. Before joining APP, Brenda was the director of a hospice program in Massachusetts. Her work at APP is focused on hospice, oncology, and home health projects. Deborah Dean Whitaker serves as the contracting officer's representative for the Hospice CAP survey and for the in-center hemodialysis survey. She has been with CMS for nearly 5 years. Prior to working at CMS, she worked at a government contractor and also, for 17 years, had her own research business. Deborah achieved her Ph.D. from Indiana University in American State and Local Public Policy. We will conclude today's webinar with a question and answer session and finally a wrap-up. We are pleased to have such experienced and knowledgeable speakers present on today's webinar. Brenda, Deborah, and Cindy, thank you for being here today. As a reminder before we begin, we encourage you to submit your questions in a Q&A panel to the right of the presentation. It is now my pleasure to turn the session over to the presenters. Cindy, the floor is yours.
Thank you very much. So as an overview for today's webinar, it focuses on the annual payment update, APU timeline or cycle. It walks you through the APU cycle, and the cycle begins with reporting of the data, and the reporting of the data follows the January to December calendar for each year. That data is used to determine compliance with the Hospice Quality Reporting Program. Hospices that are fully compliant receive their full annual payment update. If a hospice is not compliant with any part of the Hospice Quality Reporting Program, then those hospices have a 2% reduction in their annual payment update. So let's begin with what is the Hospice Quality Reporting Program, HQRP. The Hospice Quality Reporting Program promotes the delivery of person-centered, high-quality, and safe care by hospices. CMS has adopted measures that were recommended by multiple stakeholder organizations and developed with the input of providers, payers, and other stakeholders. The HQRP requirements. So currently there are 2 requirements for the Hospice Quality Reporting Program: the Hospice Item Set Data Collection and Submission, and the CAPS Hospice Survey Submission. All Medicare certified hospice providers must comply with these 2 reporting requirements for all patients in their hospice. So we like to use this easy visual to remember what are the Hospice Quality Reporting Program requirements. The Hospice Quality Reporting Program requirements equals the Hospice Item Set requirements plus the CAPS Hospice Survey requirements. This means your hospice must meet all requirements for the Hospice Item Set and for the CAPS Hospice Survey to meet the Hospice Quality Reporting Program requirements and receive your full annual payment update. So now let's look at the submission requirements for each part of the Hospice Quality Reporting Program. First, we start with the Hospice Item Set. So for the Hospice Item Set, all Medicare certified hospice providers are required to submit the Hospice Item Set admission records and Hospice Item Set discharge records. The Hospice Item Set data are collected and submitted on all patient admissions, regardless of the payer, the patient's age, or location of the receipt of hospice services. The information captured includes items used in the calculation of 8 National Quality Forum endorsed quality measures. So again, the annual payment update cycle starts with data collection. The data for this calendar year this calendar year, which is 2019, began on January 1st and runs through December 31st. The Hospice Item Set data needs to be submitted and accepted within the acceptable thresholds. The Hospice Item Set threshold is now 90%, which means each hospice must have 90% of its HIS data timely submitted and accepted to meet the HIS portion of the Hospice Quality Reporting Program requirements. This table is added here to show you how data that you start in the beginning of the calendar year, and we started this 90% threshold for the Hospice Item Set beginning in calendar year 2018. So starting in 2018, for every year thereafter, so this year and 2019 and so on, you have to meet a 90% threshold of your Hospice Item Set submissions. So data, let's just start and look at this chart. So data that you submit in calendar year 2019 from January to December will then be used for the reporting year for the fiscal year 2021. So we go from calendar year to fiscal year. So we start with calendar year 2019, and then that data is used to impact your annual payment update in fiscal year 2021. And this chart is just showing you that it follows that same process every year thereafter. So for calendar year 2020, it affects your fiscal year, your annual payment update in your fiscal year 2022, so 2 years later. I will now turn to the discussion over. I will now turn to the CAPS hospice survey portion of the Hospice Quality Reporting Program, because it has its requirements that also must be met. So for those requirements include that all Medicare certified hospices must participate monthly for all 12 months in order to receive their full annual payment update. They must contract with an approved survey vendor. The vendor must successfully submit the data to the CAPS data warehouse, and the data collection year also runs from January 1st through December 31st. So each hospice is submitting his and CAPS data from January 1st to December 31st to meet the Hospice Quality Reporting Program requirements. And with that, I will now turn this discussion over to Brenda Karkos. So thank you, Cindy. Now let's take a look at that HQRP life cycle that Cindy's mentioned. We'll talk about the role of the hospice and how and when compliance is determined and how the process leads to an impact on the APU. So Cindy mentioned about the submission thresholds for the HIS reporting and submission of the CAPS data. These activities are on a cycle, and the cycle spans over a 2-year period. This graphic shows the cycle. The first section in blue is showing the hospice's role in data collection and submission during a 1-year period. This is showing January 2018 through the end of that year until January 1st of 2019. The compliance determinations occur at the beginning of that next year, and the payment impact occurs on October 1st of 2019, which is actually the fiscal year 2020. Throughout this cycle, there are several time points to be aware of, so we'll go into more detail using the graphic as a guide. Let's look at the individual components of this cycle. Let's start with the data submission as we begin the cycle. This includes both the HIS and the CAPS data, those two components of the Hospice Quality Reporting Program. This is the first part of the cycle, and it's up to each hospice to meet the required thresholds. Your hospice's submission of both the HIS and the CAPS data will determine your APU in fiscal year 2020. So the next step in the HQRP life cycle is the compliance determinations, which are made once CMS reviews the data. CMS will then send out letters of noncompliance for any hospices who have not met the HQRP requirements. These letters are sent in July to the hospices once the determinations are made by CMS. So we discussed that compliance is determined in the year that follows the data collection year. If hospice providers fail to reach the 90% threshold for the HIS submissions, or if they don't comply with these CAPS survey requirements, they will receive notification by CMS. This notification will be in the form of an HQRP noncompliance letter. CMS sends this letter in 2 ways, both by the U.S. Postal Service and via the Certification and Survey Provider Enhanced Reports, or through the CASPER system. The CASPER letter will also identify why the provider is not compliant. As providers, you'll need to check your CASPER folder to determine if your hospice has received one of these letters. It's important to be aware as soon as possible if you're non-compliant, as the letter also alerts the providers how to request a reconsideration. And we'll talk about this next, but in a much more detail a bit later in the presentation. So let's look at the reconsideration requests. Providers receiving these noncompliance letters may submit reconsideration requests to CMS and will have 30 days from the date on their letter in which to do so. It's important to know about the noncompliance letters and to be on the lookout for one. If you have any concerns, a hospice can request reconsideration, but the day that CMS sends that noncompliance letter begins that 30-day reconsideration request period. Since the letters are sent in July, this period will generally fall between July and August. So, for example, in 2017, the reconsideration request period began on July 18, 2017, and it ended on August 17th. Later, we'll get into the entire reconsideration process in much more detail. If your hospice has applied for a reconsideration, you will be notified about the results by CMS, and this notification will fall somewhere between August and September. And once the reconsiderations are reviewed and providers are notified, the APU will be determined and implemented. The implementation of the APU occurs on October 1st of each year. But remember that it reflects the data collection period from almost 2 years prior, January through December of 2018. So let's talk a bit more about the APU implementation. Compliance with the HQRP impacts your hospice's annual payment update, or that APU. And it is the act of submitting and the acceptance of the data that determines compliance with HQRP. It's not your actual performance on the quality measures or on the hospice caps. Failure to comply with the HQRP requirements will result in a 2% point reduction in the APU for hospice providers. And failure to comply also does affect your results on Hospice Compare. So this last phase will be the receipt of the APU. So all of these events in this HQRP life cycle will occur before the hospices can receive their full annual payment update. Receipt of the full APU is possible for hospices that meet the HQRP requirements. In other words, in order to preserve your full annual payment update, a hospice must fully meet all the requirements that mandate the collection and submission of HIS admission and discharge data for all patients admitted to their hospice, and they also must participate in the CAPS for the 12 months of the year. So now let's talk a little bit about reporting for part of the HIS and the CAPS. Well, I think you should be clear on the HQRP requirements now, and you know that hospice must meet the requirements for both HIS and CAPS, and the data must be submitted and accepted on time. So let's move on to submission. So Cindy mentioned what needs to be submitted from the HIS to comply with HQRP, and that is that all Medicare certified hospice providers are required to submit HIS admission records and the HIS discharge records for all their patients. If you've already been doing this for the last few years, you certainly know what that entails. But let's now talk about when to submit the data. For the HIS specifically, this data needs to be submitted and accepted within 30 days after the event date or the target date. A hospice has exactly 30 days to accurately submit their HIS admission data. This is the same for discharge data as well. You may remember that the act of submission does not equal acceptance. So it's highly recommended that you submit data within the first 14 days, ideally 7 to 14 days to be safe, and to be sure that it is accepted by the 30-day deadline. If you experience any issues, you still have plenty of time to ensure the acceptance of your data. Unlike the 14-day recommendation, the actual 30-day submission timeframes are requirements. These are not recommendations. If you need more detail on what to submit, as well as complete information about the HIS and the requirements, we would recommend that you preview some of the previous learning events, and these can all be found on the CMS website. We're going to share some resources for you, and they'll be on the slides at the end of the presentation. So now let's talk about where to submit this data. HIS data is submitted into the CMS Quality Improvement and Evaluation System, or the KEYS, Assessment, Submission, and Processing, or ASAP. This is referred to as the KEYS ASAP system. To submit into the KEYS ASAP system, hospice providers need to take several steps, including obtaining a CMS Net user ID and password, ensuring that the proper software is installed on the computer you plan to use, obtaining a KEYS user ID and password, and ensuring that the HIS records are in the proper electronic format for submission. One important resource for submitting HIS data is the Hospice Submission User's Guide. This guide is available for download, and the links are listed on the slide that you will see at the end of the resource section at the end of the presentation. You'll want to make sure that you reference this guide for any questions you have about the submission process, since there are a lot of great details there. So before your data can be submitted, you'll have to make sure that the HIS data is in the proper electronic file format, and that is called XML. It's important to receive training to ensure that your submissions are in the correct format and contain the correct information so that they'll be accepted into the KEYS ASAP system. Some agencies do have their own software for submission of this part from their electronic medical record, but other hospice providers choose to use the Hospice Abstraction Reporting Tool, or the HART software, which is a free software that's available from CMS. So now we know where to submit the data for HIS records. We would like to talk about how to ensure that your data was submitted and accepted into the system. Once you submit your records into the KEYS ASAP system, the system will provide an online submission confirmation that the file was received for processing and editing. The system checks, that is, it validates the files to make sure that they're complete and in the proper format. It's important to know that this confirmation does not mean that your data were actually accepted. So even though HIS records are successfully submitted, it doesn't mean that they've been accepted. The online submission confirmation includes the name of the file that you submitted, and since this confirmation does not mean it was accepted, it's really suggested that you print this and keep a copy of the confirmation for your records. Within 24 hours, though, of successfully being able to process the file, a system-generated final validation report, or the FVR, is created and made available in the CASPER reporting application. The final validation report, FVR, is used to verify whether the HIS records were accepted or rejected. The FVR is the only way to verify that submitted files were also accepted. Hospices will want to access this FVR to verify whether the records were accepted or rejected, and then review to see if there were any errors noted. It's important because records that are rejected by the ASAP system are not received by CMS, and they cannot be used in your quality measure calculations or for compliance determinations. And now I'm going to turn this over to Deborah Dean Whitaker, who's going to discuss the CAP submission process in more detail.
Thank you very much, Brenda. The first thing I want to mention to you about CAPS is that CAPS is different from HIS. It has separate procedures, separate requirements, and separate deadlines. So put on your CAPS hat and let's talk about CAPS. First, you're required to collect CAPS data for all 12 months of the calendar year, January 1st through December 31st. This is called the data collection year. We are now in the 2019 data collection year. It started on January 1st. CAPS Hospice Survey data is submitted to the CAPS Hospice Survey Data Warehouse. Your survey vendor submits your survey data on your behalf. Data submission deadlines occur quarterly. They are on the second Wednesday of the month for the months of February, May, August, and November. So we will have a February deadline coming up. We cannot accept late data. The act of submitting data is not the same thing as the successful submission of data. Compliance is measured by the successful submission of CAPS survey data to the CAPS survey data warehouse. It is critically important that your vendor successfully submit your data and do it on time. If your vendor does not successfully submit data to the data warehouse, you will be out of compliance and your annual payment update will be subject to a 2% reduction. It is therefore a very good idea for you to gain access to the data warehouse and review reports about your data submission. And it is also important to stay in touch with your vendor. Here are some things you can do to increase the probability that the data you submit are accepted and that you are successful in submitting data. First, you must contract with a CMS-approved vendor. This is a requirement. There is a list of vendors on this survey data website, and the URL for that will be shown in a slide coming up, and I'll call it to your attention. There are quite a few vendors on this list. We'd suggest you call a few of them and see what you think. Also, you must authorize your vendor. Your vendor cannot submit data unless they are authorized to do so. This has been a place of trouble sometimes for hospices because they forgot to authorize the vendor, and the vendor's banging on the door to get in to the data warehouse and can't. You cannot submit data without authorization. We also say, again, communicate with your vendor. And monitor data submission. Make sure your data is successfully submitted before the deadline. Make sure you know how to get reports from the data warehouse. You must go to the survey website. Again, I'll show you the URL. Choose the Information for Hospices tab on the left-hand menu, and that page will have instructions on how to get reports. It will also have instructions about how to authorize your vendor. Now I have a tip, and it's very important. Contact us if you want to change your vendor. We're not going to tell you you can't do it. But remember, you have to have data being collected every month of the year. Now suddenly you're changing the vendor. So you're collecting data while you're changing the vendor. It's a high wire act. And if you misstep, you can fall out of compliance. We can help you prevent that. Contact us if you want to change your vendors. Our contact information is also on the survey website. Please contact us. We're happy to walk you through it. We're happy to handhold you through it so you don't have a problem. Another thing I would suggest is we recommend you keep this in mind. When you buy a hospice, if you work for a hospice company and they're buying a hospice, you're buying their CAP status. If the hospice you buy is compliant with CAPS, you want to think about whether or not you want to keep their current vendor or change vendors. And if you're going to change, you want to let us know. You may also want to consider their CAP status in terms of are they compliant or not. Just word to the wise, I would suggest that you keep this in mind. Now I'd like to talk to you about CAPS Hospice Survey exemptions. Both of these exemptions are unique to the CAPS Hospice Survey and to the, I'm sorry, I have lost the meeting, so I'm going to go ahead as if it did not happen. And if there's a problem, please let me know orally. There are two CAPS Hospice Survey exemptions. One is size and one is for newness. I'm going to start by talking about the size exemption, and I now have a size exemption up number 46. If your hospice served fewer than 50 survey-eligible patient-caregiver pairs in the reference year, you are eligible to apply for a size exemption. To apply for the size exemption, you should go to the survey website, and there it is, ladies and gentlemen, www.hospicecapssurvey.org.
Hi, this is Charles Padgett, and I'm just going to finish up for Deborah Dean Winokur here. We're having some phone problems. So she was going over the CAP size exemption, and so I'm just going to go over that again. As she stated, if your hospice served fewer than 50 survey-eligible patients or caregiver pairs in the reference year, you are eligible to apply for a size exemption. And in order to do so, you can go to the survey website, which is www.hospicecapssurvey.org. Then you're going to look for the participation exemption for size, and then you'll fill out the form that's available, and you can submit that form online. To fill out the form, you count patients in the reference year. The reference year equals the previous year. So the current data collection year is 2019 that we're in now, for example. So the reference year is going to be 2018. The exemption is only good for 1 year. You need to resubmit a request annually for this exemption, and the deadline for requesting a size exemption is December 31st of 2019, and that's the 2019 data collection year. After you submit the form, you're going to receive an acknowledgement email. That does not mean that you're approved. That's important to know. We check your counts before the APU season and then decide. Save the acknowledgement email for future reference so that you have it. And then for the second exemption, which is the newness exemption, if you receive a new CCN on or after the start of the data collection year, then you are automatically exempted for 1 year. CMS grants that exception. Once again, we recommend that you save your letter with your new CCN and save the envelope. So now there is a polling question, and this is asking, where do you submit your HIS data for the Hospice Quality Reporting Program? Your options are A, the Hospice Survey Data Warehouse, B, the RAND Corporation, C, the Quality Manager at your hospice, or D, the KEYS ASAP system. And it looks like the majority of folks got it right. Looks like we have about 97, almost 98% that answered D, the KEYS ASAP system.
Hey, thank you, Charles. I can take it for the next question.
Sure.
Okay, so our next question is, who submits CAPS data for the HQRP? Is it the Hospice Survey Data Warehouse, the RAND Corporation, the Quality Manager at your hospice, or your survey vendor submits your data on your behalf? So it looks like we have quite a few answers coming in. And the answer is D, your survey vendor submits your data on your behalf. Okay, so thank you. And we're going to get moving on to the CASPER reports themselves. So today we'll give you a brief overview of the reports that you can find on the CASPER reporting application with some simple explanations about how to use them. And we're not going to provide a lot of detail today, but there is much more information on some of the trainings that we've done previously, and you can find these on the CMS website. And some of those resources will be listed at the end of the presentation. So there are many valuable hospice-specific reports available in CASPER. The CASPER reporting link is available to providers on the Welcome to the CMS KEYS System for Providers webpage. You can obtain more information about the reports highlighted in the presentation in the CASPER Reporting User's Guide. And this User's Guide is available on the CMS KEYS Systems Provider webpage and also on the KEYS Technical Support Office, or QTSO, website. Now let's get into the reports that you'll find in CASPER. So the first thing to know is that there are two report categories. One is called the Hospice Provider Report category, and the other is the Hospice Quality Reporting Program category. And you can see the Hospice Provider Report category is circled in red here. There are 4 types of error reports, and these are the HIS record errors by field by provider, the HIS records with error number XXXX, the HIS record error detail by provider, and the hospice error number summary by provider by vendor. So I'll give you a brief explanation of each of these. So the HIS record errors by field by provider. This report shows by error the number of HIS records where the particular error was encountered and the percent of HIS records that had that error during a specific time frame. The HIS records with error number XXX is a user-requested on-demand report. So this one assists you in researching the cause of any late submissions by running for errors such as number 3034A or 3034B. So here's a sample of the HIS record errors by field by provider report. And you can see that the first error by number in this first column is number 3034A. And this message tells us that the record was submitted late. So once you have this information, you can actually run the other report we talked about, the XXX number, and you can get a list of the patients and the dates where this error was encountered. And then you might research what could have happened and how to prevent this error from happening in the future. So let's look at these two other error reports. These are the HIS record error detail by provider and the hospice error number summary by provider by vendor. So the first one tells us some details about the HIS ID, the errors encountered in the hospice item set records that were submitted during a specific period. And the report can help us address recurring errors, can also be used in quality assurance via QA program if you have repeated errors. The second report it summarizes the errors submitted by or on behalf of the provider during a specified period. So it helps to determine and report vendor-specific issues such as recurring fatal errors. And you can use these two error reports to gain more detail regarding the errors that were encountered during the HIS submission. So this screenshot just shows you the report categories option for the HIS record error by detail report. And the CASPER report submit pages for the other hospice reports may look very similar. And you can refer to Chapter 3 in the Reporting User's Guide for some specific information about each of these reports. To request this report, you just choose the date range on this drop-down menu. The HIS record error detail by provider report can identify which errors occurred during that particular date range. So now let's move away from the error reports and look at the hospice admissions report. This report is for details regarding patients who were admitted within a specific period. This lists only patients with an accepted HIS admission submitted with an admission date within this specified period that you choose. In this report, the date range requested was October 1st to October 4th. So the information in this will give us any patients that were admitted and accepted during that time frame. And you can see on this one, this is very similar to the admission report, but this is the discharge report. And it lists only patients with an accepted discharge submitted within the discharge date in that specific period. And this one is from October 1st, 2016 to the September 30th, 2017. And this can be used to verify that an HIS discharge record was submitted and accepted by the ASAP system for each hospice patient during that specific time period. So here's a really important report, and this is the final validation report we spoke about earlier, or the FVR. We know that it's critical for hospices to ensure that submitted records have been accepted. If a record gets rejected, the hospice must correct the errors that caused the record to be rejected and resubmit to the ASAP system. That's why it's important to submit your records really early before that 30-day deadline. So the FVR will indicate whether the records submitted in each file were accepted or rejected, and it will give you detail if there are any fatal errors or warning messages that were encountered. This report is auto-generated, and the ASAP system patient-generated FVR is automatically purged from the system after 60 days, although it can be user-generated upon request if you fail to make a copy of it when you had it available to you. So here's a screenshot of the hospice final validation report. The top part of the report contains the details of the file, such as the date, the time the file was submitted, the user ID that submitted the file, and some hospice-specific information. And it includes a summary of the submission statistics for the HIS records contained in the zip file, such as the number of records processed, the number accepted, and the number rejected. And beneath this is some information about each HIS record processed by the ASAP system, including the record and patient-specific information. So you want to check to make sure the information on here is correct and the record was accepted. So now let's talk about the hospice submitter final validation report. So the final validation report is automatically generated, but that's only for HIS submission files for which the provider of the file could be identified. In contrast, this report, the hospice submitter final validation report, must be manually requested. The contents of this report are very similar to the system-generated report, but the submitter report will display error details for records that could not be processed by the system because the provider associated to the file couldn't be identified. So this report provides detailed information about the status of selected submission files. It indicates whether the records were accepted or rejected. It details warning messages and fatal errors, but it can only be requested by the user who submitted the original file. So examples of when you might use this would be, for some reason, the system-generated FVR is not available in the folder after 24 hours. The total record count on the list of submissions in the hospice file submission is displaying a 0. So this indicates that there's a severe error, and so that's when you might use this report to find out what the error was. So this next report is the hospice item set print report. It can be requested only for HIS records that were accepted into ASAP. This report lists the item number and item responses submitted for each HIS record. So this one allows for some easy viewing of the values that were submitted for the HIS item in the individual record. This report could be useful if the hospice has some questions about why a patient did or did not trigger the hospice quality measure. So this next one is the hospice item set submission statistics by provider report. And this one summarizes the submissions made during a specified period and the statistics for each submission. It allows electronic compilation of information that would otherwise have to be manually retrieved from the individual FVRs. In this sample report, you can see that the report displays the submission date, the time, the submission ID, and the following information. It has the number of records successfully processed from the file by the ASAP system. It has the number of records rejected or not saved into the system because of some fatal errors. And it has the number of records that passed the ASAP system validation and were saved into the national database. And the percent of records from the submission file that were rejected. And you can see on this screenshot that something was wrong on September 22nd, as 10 of the records processed, all of them, 100% of them, were rejected, however. So here is one called the Hospice Item Set Submitted Report. And it lists the accepted HIS records and inactivation requests submitted by or on behalf of a provider during a specified period. In the sample report here, it displays patient identifying information such as the ID, the patient name, Social Security or Medicare number, and it also displays the HIS reason for assessment value. So that is whether it's an admission record or a discharge record. And it has the date the record was submitted into the ASAP system and identifies the record type, whether it was a new record or a modified record. Okay, now this is the hospice roster report. This is also a very good reference for you. It helps you to verify that all your current patients have had their appropriate HIS admission record accepted. and that all discharge patients no longer display to verify that their discharge record has been submitted. And it can be used as a good quality assurance tool. All the patients on this report are considered active patients as of the day the report is run. This report is one way to do a quick check to make sure there aren't any discharge patients who have not had their discharge records submitted, or any active patients for which you have not yet submitted an admission record because their names will not appear on the report. So this is the last one on this list, and it is one of the most important reports for checking compliance for HQRP. And this is the Hospice Timeliness Compliance Threshold Report. You can see it highlighted here on the list. The Hospice Timeliness Compliance Threshold Report is a user-requested, on-demand report in CASPER. And we'll go through this in a bit more detail. With this user-generated report, the fiscal year is the only submit criteria, so you just have to choose what year you want to look at. This report summarizes for the selected fiscal year the number and the percent of HIS records submitted within the 30-day submission deadline. So it has the number of HIS records submitted, the number submitted on time, the percentage of HIS records submitted, and it also has the identifiers such as the CCN or the facility ID. So this timeliness compliance threshold report provides the percentage of HIS records submitted within that 30-day submission deadline per fiscal year. The bottom of the report also identifies the required percentage for the year, which would be 90% at this point. So here's a sample of what it looks like. So this is a good way to keep track of how you're doing in terms of your compliance with the HQRP. This one shows the number of HIS records was 67, and the number of records that were submitted on time were 46. So the percent of records submitted on time were 69%. So they have a little work to do to make sure they meet the required threshold. So now we're going to move away from the provider reports to a different category, and these are the Hospice Quality Reporting Program report category. And to access this category, you'll go to the Reports tab, and then you'll select the Hospice Quality Reporting Program, which is on the left, encircled in red. So these reports are user-generated on-demand reports in CASPER. The first one, the Hospice Level Quality Measure Report, shows the CMS measure ID, the numerator and the denominator for each measure, and it also shows the hospice's observed percent, the comparison group national average for the same time period, and the comparison group national percentile. And the second report, the Hospice Patient Stay Quality Measure Report, identifies each patient whose qualifying HIS record was included in the quality measure calculations for the selected period. So here's an example of the Hospice Level Quality Measure Report. For each of the 8 measures, the report shows the CMS measure ID, the numerator, and the denominator. And you can see the hospice's observed percent, which is 100% in some categories, the comparison group national average for that same time period, and the comparison group percentile. The comparison national percentile indicates the hospice's rank nationally. For example, the pain screening measure percentile of 29 on the report indicates that 29% of the hospices in the nation had a quality measure score that was less than or equal to this particular hospice. So in other words, they performed the same or worse than this hospice. So this hospice, again, has some work to do on pain screening to get higher up in their percentile. So here's an example of the Hospice Patient Stay Level Quality Measure Report. And this report provides a breakdown of the hospice level report for the same time period. And this report indicates the measure status per measure per patient. So I'll describe a little bit of the values that you're seeing. A B displays when the measure was not triggered, and the B is in bold. An E displays when the measure was excluded. There was an X displayed, and that shows that the measure was actually triggered, and this means it passed the measure. And you can see a C in this document because the admission record was missing. A C is displayed at the admission date column next to the date to indicate that the admission date was extracted from the discharge date. So something happened with the admission record that it can't find it. For example, the hospice comprehensive assessment measure is reported for stays with admission dates greater than or equal to April 1st, 2017. And for stays with admission dates prior to that, the result of the measure would be showing a D. So these last few are called the Hospice Provider Preview Reports, and they can be found in CASPER. And these are two separate reports that are automatically stored in your provider's shared folder in CASPER. This is not the same VR as the final validation report. The purpose of these reports are to give providers the opportunity to preview their HIS quality measure results and hospice CAP survey results prior to public display on Hospice Compare. These two separate reports are located in your CASPER folder, the Hospice Provider Preview Report and the CAPS Hospice Survey Provider Preview Report. And hospice providers are encouraged to use these reports to review their HIS quality measure results and their facility-level CAP survey results. So prior to each quarterly release of data on Hospice Compare, the hospice providers are given an opportunity to review their results during the 30-day preview period. These reports are provided after the freeze date, after which providers cannot make changes to their HIS records. Because of this, hospices are not able to make changes to the underlying data. So providers need to take action to ensure all the data is accurate before the freeze date, and if hospices fail to make necessary corrections to their HIS data before the specific freeze date, CMS will base the measure on the data that they have at that time. So should a provider believe a denominator or something in that quality metric is in error, they can request a CMS review. These reports are available for a period of 60 days from the report release date. Hospices are encouraged to download and save these reports for future reference. So here's an example of the provider preview report, and you can see the hospice identifying information at the top, and beneath the measure, the results. And here's a sample of the CAPS Hospice Provider Preview Report. And this report will show you each measure category and your hospice's percent for the bottom, the middle, and the top responses. And it also shows you the national percentages for each of those. So you compare yourself to others in the country. So let's just review by asking a few questions of the audience. So here's our first question regarding the material that was just presented about the reports. Which report provides detailed information about the status of select submission files? Is it A, hospice item set submission statistics by provider, B, hospice final validation report, C, the hospice item set submitted, or D, HIS record error detail by provider? A lot of people are chiming in here. Looks like most people are choosing the hospice final validation report. And that's correct. The answer is B. It's the FVR that provides the detailed information about the status of select submission files. And remember, this is the one that's auto-generated for each and every submission, and it's placed in your provider's validation report folder. Okay, so now for one more question regarding reports. Which report provides the percent of HIS records submitted and accepted within the 30-day submission deadline per fiscal year? Is it the hospice item set submission statistics by provider, the HIS records with error number XXX report, the hospice timeliness compliance threshold report, or D, hospice level quality measure report? Like most people are choosing. That is the correct answer. So C is the correct answer. It's the hospice timeliness compliance threshold report. Okay, so we're going to go into the reconsideration process next and talk more about details about that process. So let's just take a look at the graphic again. Once CMS makes that initial determination at the beginning of the year, they will notify hospices who did not meet the compliance threshold. And this will be that letter of noncompliance that we spoke about earlier. And once the letter arrives, the hospice will have exactly 30 days from the date on the letter to request a reconsideration if they don't agree with the notice. So what exactly is reconsideration? Well, reconsideration is a request for a review of the noncompliance decision prior to the 2 percentage point reduction in the hospice's APU that will take effect on October 1st, so the beginning of the next fiscal year. So non-compliant providers will be notified of the decision through this letter we spoke about by U.S. mail or through the CASPER system. So we talked about the APU and that any hospice determined to be non-compliant will be subject to a reduction by 2 percentage points. And this can occur if they're non-compliant with either HIS or CAPS, or both the HIS and the CAPS. So if you believe your hospices have been identified for this payment reduction in error, you do have a right to request this reconsideration. And we've listed the website here, but there's more information at the end of the presentation on those resource slides as well. So hospices can file for reconsideration if they receive the letter and if they believe that they've received the letter in error. And they have 30 days from the time they receive, or the date on that letter, to actually submit a request for reconsideration. Failure to submit it in a timely manner means that you will be subject to the 2 percentage point reduction. So let's review the process for this. First, CMS will notify the hospices that they're non-compliant, and then hospices should look for that letter and be sure to access their CASPER system, since either letter serves as notice for the non-compliance. And hospices that receive the letter can certainly request a reconsideration if they feel it's in error. Now let's walk through what you do need to do to create this reconsideration request. The only method to use for this submission is email. Late requests and those submitted by any other means will not be reviewed. And the request must be sent to the following email address. And again, it's listed here as well as at the end of the presentation. So the subject line should read Hospice ACA 3004 Reconsideration Request and include the hospice's CMS certification or CCN number. And the email must include the following information: the CCN number, the business name and address, the name of the CEO or designated representative, and the identified reason for noncompliance that CMS put in the letter. And you'll also include any information you have to support your belief that this was in error. So you really need to include all the evidence you have about why you should not be found in error. So this request for reconsideration must be accompanied by any supporting documentation demonstrating compliance. CMS won't be able to review a request without the necessary documentation. So just some examples of documentation you could include might be some email communications, or for HAS reporting, you might include some of the final validation report information from the CASPER system. Or for CAPS, you might have evidence that your hospice served fewer than 50 survey-eligible decedents, or that there was continuous data collection throughout the 12 months. So since email is not secure, you have to be really careful you don't include any PHI or PII or any HIPAA violations, as this will send a security alert to CMS when your information is sent over. So CMS should acknowledge the receipt of the reconsideration request within 5 business days through an email. Following its review of the request and supporting documentation, they will issue a decision. And this will come through regular mail, through the MACs, or an electronic letter through the CASPER system. If the decision upholds the finding of noncompliance, the provider may file an appeal with the Provider Reimbursement Review Board. So let's just review this whole timeline for reconsiderations once more. In July, non-compliant hospices that fail to meet the hospice quality reporting requirements are notified. CMS will prepare letters for CASPER and also send these letters to the MACs, and these will be sent over by U.S. mail to the hospices. During July and early August, the reconsideration requests are due, and these will be due to CMS exactly 30 days from the date on that letter. And in late August to September, CMS will notify hospices of the decision on the reconsideration requests. On October 1st, any hospice determined to be noncompliant will be subject to the 2% reduction in their APU for that fiscal year. So that wraps up our discussion on reconsideration. We just have a few more knowledge checks to go through. So which of the following statements is not true in regard to reconsideration? Is it A, a hospice has 30 days to submit a request? B, CMS will contact the hospice if they have further questions? C, requests can be sent only by email? Or D, CMS will issue its decision by regular mail and through the CASPER system? So it looks like the answer is B. CMS will contact the hospice if they have further questions. Okay, so I'm just going to quickly run through the resource slides, and then we'll have some Q&A. So these last few pages just have resources that you can follow these links to find more information. On this page, you'll find resources for the HQRP reporting program on the CMS website, for the CAPS survey information. Links here will give you resources on the provider preview reports and the reconsideration request webpage, which has lots of information we just went over. And here are some other resources on the KEYS Technical Support Office, or QTSO, website, as well as how to obtain the Hospice Submission User's Guide and CASPER Reporting User's Guide. And if you want to see some previous trainings, which again had much more detail about these reports, you can go to the training library, and there's lots of great information in there on previous trainings that we've done, as well as look at requesting hospice reports via CASPER. You can find more information there on how to request reports. And then this is just some information about the different quality help desks, the Hospice CAPS Survey Help Desk, and the CAPS Hospice Survey Data Warehouse, the KEYS Help Desk, and APU Reconsiderations Help Desk. Now I'm going to turn it over to Sharon, I think. So for the question and answer section, I think we're going to be doing questions on the different topics throughout the presentation. So this is Cindy Masuda, and I'm going to start with the first question. So can you tell me how I get started with the Hospice Quality Reporting Program? Well, as we discussed in the first section of this presentation today, to be compliant with the Hospice Quality Reporting Program overall, hospice providers must comply with the individual requirements of both the hospice item set and the CAPS hospice survey, and these requirements do differ. There is a document in the download section of the Hospice Quality Reporting Program webpage called Getting Started. I would suggest you go to the CMS website under the Hospice Quality Reporting Program and bookmark that page. Once on that page, scroll all the way down to the download section, and you will see a document dated September 2017. This Getting Started PDF will help guide you on starting the process. And in order to provide time, since this webinar goes to 3:30, I'm going to turn to my colleague, Deborah Dean Whittaker, for questions related to CAPS.
Thank you very much. And I want to thank Charles for stepping in. I don't know what happened, and I'm sorry about that. Here's my first question. I have looked at the CAPS Hospice Preview Report for our hospice. It doesn't seem right to me. Is it possible to request a review of our CAPS preview report data? The answer is yes, you can. On the CAPS preview report, there is an orange box that provides instructions for what to do if you would like to get your data reviewed. It connects you really with the technical support team. So please look at your report, look at the orange box, and you will see what to do. We've had another question. I've had some problems with our survey vendor, and we missed a few months sending out the CAPS data next year. Last year, will this impact our APU? The answer is probably yes. Unless you are exempt for size or newness. To comply, you need to have participated monthly for all 12 months. There are disaster exemptions that do exist, so you may want to look into that as well if you were subject to a disaster. And now I believe I turn this over for question to my colleague Brenda.
Sure. Hi there. I have a question here that says it's about the CASPER reports. When speaking about the reports, you mentioned that there are warning messages and fatal errors. Can you talk more about the differences between these two? And I'm going to turn this over to Charles for the answer.
Sure, thank you. So the warning messages alert you to inconsistencies or issues that you should be aware of or you may want to address. But with a warning, the issue is not severe enough actually to reject the record. Records with only warning messages are still accepted into the database. So examples of warnings can include late submission warnings, inconsistent responses, or dates. In contrast, however, the HIS records that receive fatal errors are not accepted into the ASAP system, so you will definitely want to monitor your final validation reports or the FVRs for these errors so that you can address and resubmit any of the rejected records to be sure that your HIS records are accepted into the national database. More information about the error messages and warnings are detailed in the HIS data submission specifications that are available on the HIS technical information page on the CMS website.
Okay, thanks, Charles. I have another one for you, actually. How often would you recommend that we run the timeliness compliance threshold report?
Sure. It's really up to each hospice to decide how often it wants to run these reports. However, monthly may be a good routine. Running the hospice timeliness compliance threshold report monthly would help you determine if you're having issues maintaining compliance with the 30-day submission requirement, and it would still give you enough time to correct the issues before it's too late to do anything about it.
Okay, thank you. Cindy, I'll turn it back to you. Do you have a few more questions? Sure, I do. I have more that have come in. So our hospice did not receive a letter of noncompliance. Does that mean we are compliant with the Hospice Quality Reporting Program? That's a really good question. So we discussed that compliance is determined in the year that follows the data collection year. If a hospice providers fail to reach the 90% threshold for the hospice item set submissions or do not comply with the CAPS hospice survey requirements, they will receive notification from CMS. This notification will be in the form of a Hospice Quality Reporting Program noncompliance letter. CMS sends this letter in two ways, both by the United States Postal Service, USPS, and also via the Certification and Survey Provider Enhanced Reports, which is our CASPER system. Hospices should be looking for the letter in the CASPER system. Compliant hospices will not receive a letter. You should also double-check your provider reports for the details about your compliance percentage, because as you know, you can identify yourself, your level of compliance throughout the year. Another question that came in is what percent of hospice item set submissions are required this year to avoid the annual payment update reduction? So the threshold for the hospice item set records in calendar year 2019 is 90%. This threshold will remain the same for each year from now on. This single threshold applies to all of the HIS records. So at least 90% of the HIS records need to be submitted on time, which is within the 30-day deadline, to meet the threshold. There are no separate thresholds for admission and discharge records. And with that, I'm going to turn it over to my colleague Deborah for any additional questions related to CAPS.
Okay, we have another CAPS question here. Does my hospice have to get a specific number of responses to comply with the CAPS hospice survey requirements? The answer is no. You do not need a specific number of responses to be considered compliant for the annual payment update. However, in order for your data to be published on Hospice Compare, you must have at least 30 complete surveys over the last 8 quarters. And now I'm going to turn it back over to Brenda.
Hi there. I have another one here about from CASPER. What if my threshold report seems off? For instance, if there's a discrepancy in the percent submitted on time and I feel that it should be higher, what should I do? So if you feel there's a discrepancy with the percentage of HIS records submitted on time in your hospice timeliness compliance threshold report, you can verify your numbers by running the HIS records with error number XXX report. And you'll be looking for errors that are 3034A or 3034B for that same period to determine which of those HIS records were submitted late. So the number of records that encountered one of those errors should equal the difference between the number submitted and the number submitted on time on your threshold report. So, for example, if your threshold report indicates that you submitted 100 HIS records in total and submitted 75 on time, then you should see 25 HIS records that received an error number during that same period, and that would make up for your 100. So you'll know there's some issue there and some discrepancy in what you're sending in. And I would recommend that you contact the QTSO help desk if you have any questions. There's a question here that we could have Charles answer about Hospice Compare. So how does all this relate to Hospice Compare? We heard a lot about HQRP, but can you explain how it relates to Hospice Compare?
Sure, happy to answer that. So Hospice Compare is actually the vehicle by which CMS publicly displays hospice quality data. And the goal of Hospice Compare is to help consumers compare hospice providers on their performance and assist them in making decisions that are right for them, healthcare decisions. When appropriate, providers can inform their patients and family members about the new Hospice Compare website and explain that the Hospice Compare website provides a snapshot of quality of care a hospice offers, and they can encourage patients and their family members to review quality ratings and use the site to help patients and family members make the best decisions for their care. More information on Hospice Compare can be found at the actual Hospice Compare website, and that is www.medicare.gov/hospice-compare/.
We have other questions.
I have a few more questions that have come in related to the hospice item set. This is Cindy Masuda. So a question that came in is, what is the penalty for not submitting the hospice item set admission and discharge in the required time allowed? And related to it, they said, does Medicare deny the claim for untimely submission, or does Medicare penalize the agency or not pay the claim altogether? So let's just clarify all this. The hospice item set and the hospice quality reporting program in general, it is completely unrelated to claim submissions and payment. So the purpose of the hospice quality reporting program is pay for reporting, and it is not tied directly to your payment of claims. The distinction is that compliance and with the requirements of the hospice quality reporting program, meeting the requirements will affect your annual payment update, and you can be subject to you can be subject to a 2 percentage point reduction in your annual payment update if you don't comply with the hospice quality reporting program. So the hospice item set is a requirement of the hospice quality reporting program along with the CAPS hospice survey. The penalty for failing to meet the hospice quality reporting program requirement is a 2 percentage point reduction in your annual payment update for the reporting fiscal year in question. So we're currently in calendar year 2019. The associated reporting year is fiscal year 2021, APU reporting year. So if you fail to meet the hospice item set or the hospice CAPS requirements for this year, your annual payment update will be reduced by 2 percentage points for fiscal year 2021. This payment penalty lasts the duration of the fiscal year involved, so it lasts for the entire fiscal year of 2021. And you can find more information on the timeliness compliance threshold on the CMS website, the HQRP webpage. There's a download called the Timeliness Compliance Threshold Fact Sheet Update, which was in August 2016, that you can find helpful. Another question that came in has to do with that I'm a new hospice and I'm trying to understand the process. Our hospice has had some problems with late submissions. Can you clarify again how late submissions of the hospice item set records impact my annual payment update? That's a very good question. Well, we discussed that all Medicare certified hospice providers are required to submit hospice item set admission and hospice item set discharge records. Hospice item set data are collected and submitted for all patient admissions. This data needs to be submitted and accepted in the system within the 30-day deadline in order to ensure compliance with the Hospice Quality Reporting Program and prevent any reduction in your annual payment update. Compliance thresholds have been incrementally increasing since 2016 and are now set at 90%. So for your hospice to receive the full payment update in fiscal year 2020, the threshold has to be met with your calendar year 2018 data. So your calendar year 2018 data had to have a 90% threshold of submitting his data. And then the single threshold applies to all of the his records. So as long as the 90% of the his records are submitted on time, that's within the 30-day deadline, your hospice will meet the threshold. It is important to submit, though, all your data, even if it is late, because the data is also reported on Hospice Compare. And with that, I will turn it over to Deborah Dean Whitaker if there's any additional questions related to CAPS.
We do not have additional questions for CAPS. May I turn it back to Brenda?
Sure. I have a question here regarding the difference between the reconsideration process versus exemptions and extensions. So they say, I'm trying to understand the difference between these two. Can you clarify the difference? So let's start with the exemptions and extensions. So Deborah mentioned in the CAPS presentation that there are exemptions for size and newness, but this is different, and that is not for HIS. So let's talk in general. CMS does recognize that there are times when extraordinary or extenuating circumstances can delay or prevent the submission of the required data. So for those instances, an exemption or an extension might be granted by CMS, such as some natural disaster or a man-made disaster that prevents timely submission. Or it could be a disaster that affects a lot of providers in a wide area, or just maybe a single provider. So these can be CMS-initiated or provider-initiated and can occur at any time throughout the year. If it's something that's provider-initiated, it's important to include all of the facts and circumstances that support your hospice's request. When an exemption or an extension is granted, hospice will not incur payment reduction penalties for failing to comply with the HQRP during that time period. Now, in contrast, the reconsideration is a request for review of the noncompliance with the entire HQRP. So this noncompliance decision is made prior to that 2 percentage point reduction in the annual payment that takes effect in October. And this period of reconsideration occurs only once a year and only for those hospices that were determined to be noncompliant with the HQRP. And that would be noncompliance with either HIS or CAPS, or for both HIS and CAPS. And more detail regarding this extensions, exemptions, and reconsiderations can all be found on the CMS website under Hospice Quality Reporting.
Thank you, Brenda.
Sure.
We're sorry we've run out of time for today's webinar. We have responded to several of the questions that were submitted today. We apologize if you submitted a question and it was not answered during this webinar. Some questions may require additional research. Please check later on the HQRP requirements and best practices webpage. This concludes today's webinar. Thank you for joining us today.